Welcome to Chapter 2 of Introduction to Health Behavior Theory. This video content is based on Introduction to Health Behavior Theory by Joanna Hayden. In this chapter, we focus on a foundational concept in behavior change, self-efficacy theory. Let's explore what it is, where it came from, and how it influences health behavior. First is, what is self-efficacy? Self-efficacy is the belief in one's ability to perform a specific task or behavior. It's about confidence, not ability. Even if someone has the skills, they may not act unless they believe they can succeed. This belief directly affects whether someone tries, how much effort they invest, and whether they persist in the face of obstacles. Albert Bandura introduced this concept in the 1970s as part of social cognitive theory. But self-efficacy became so central, it evolved into a theory of its own. Second is why self-efficacy matters. Self-efficacy influences everything from quitting smoking to sticking to an exercise plan. People with high self-efficacy are more likely to take action and stick with it. People with low self-efficacy may give up easily or avoid the task entirely. That's why health educators must learn how to assess and strengthen self-efficacy. Third is the four sources of self-efficacy. Bandura identified four key ways that self-efficacy is developed or changed. The first source is mastery experience. This is the most powerful. When people succeed at something, their confidence grows. Repeated success builds belief in one's ability. Failure, especially early on, can undermine it. For example, someone who successfully manages their blood sugar through diet feels more capable of continuing that behavior. The second source is vicarious experience. This happens when we observe someone else performing a behavior. Seeing someone like us succeed gives us the confidence that we can do it too. For example, watching a peer manage their anxiety through meditation may inspire us to try it ourselves. The third source is verbal persuasion. Words of encouragement or support from others can boost self-efficacy. This is especially effective when the person giving feedback is credible or trusted. A health coach saying, "You've got this," can mean a lot if it's backed by realistic strategies. The fourth source is physiological and emotional states. Our body and mood influence our confidence. High stress or anxiety can lower self-efficacy. Feeling calm, energized, or well rested can increase it. That's why managing emotional well-being is part of building self-efficacy. Fourth is applying self-efficacy to health behavior. Self-efficacy plays a role in nearly every health behavior. People with high self-efficacy are more likely to exercise regularly, quit smoking, manage chronic illness, use contraception or condoms, attend preventive health appointments. Self-efficacy helps people overcome barriers and bounce back after setbacks. It's especially important in behavior change programs that require sustained effort. Fifth is measuring self-efficacy. Self-efficacy is measured using behavior-specific scales. These tools ask people to rate their confidence in performing a specific action. For example, how confident are you that you can exercise for 30 minutes, 3 times a week? Responses are often on a scale from 1 to 5 or 10. The results help educators tailor interventions to meet people where they are. Sixth is how to enhance self-efficacy. Health promotion programs can actively strengthen self-efficacy. Effective strategies include mastery opportunities, let people practice and succeed in small steps. Role models show examples of others who have succeeded. Supportive feedback, offer praise and encouragement. Stress reduction, teach coping skills to manage emotions. For example, a diabetes self-management class might include cooking demonstrations, peer success stories, motivational coaching, and mindfulness techniques. All four sources of self-efficacy are addressed to maximize confidence and engagement. Seventh is strengths and limitations of self-efficacy theory. Strengths, supported by decades of research. Easy to apply across diverse populations and behaviors. Helps explain why people succeed or struggle with change. Limitations. Confidence does not always equal action. Environmental or structural barriers may still get in the way. Self-efficacy may be high, but without access to resources, behavior change can still fail. That's why it's important to use self-efficacy theory along with other models and strategies. Let's summarize. Self-efficacy is one of the most powerful predictors of behavior change. When people believe they can succeed, they are more likely to act, persist, and overcome obstacles. As public health professionals, our job is to build that belief. We do that by designing programs that foster mastery, model success, offer encouragement, and manage emotional barriers. Because belief in oneself is often the first step to lasting health behavior change. This video content is based on Introduction to Health Behavior Theory by Joanna Hayden.